choice.
Now we need to put some headphones on you, Simon, because I've got some things to play you, including some comments about the reorganisation, but also about cottage hospitals and so on. So let's do that. And first of all, the whole thought of A&E basically moving here to Bournemouth and Poole dealing with surgery, not everyone agrees with what's happening. Have a listen.
My name's Debbie Monkhouse. I'm a member of Defend Dorset NHS. People in Swanage and neighbouring villages won't be able to access A&E and maternity services within safe guidelines once these services are lost at Poole.
My name's Damien Stone. I was one of the original founders of Keep Eye NHS Public Dorset. Going forwards, we're going to close Poole A&E. I mean, there's going to be a net loss of 178 beds all across Dorset. This is no way to deal with what is this ongoing crisis.
My name's Claudia Soren. My youngest child had several long stays in the Kingfisher ward. My main concern was that children's and mums and babies' lives would be put at risk. I'm concerned for the future of the NHS in Dorset. Funding has been frozen, beds are being cut, and we're ending up with a third-rate service, and something has to be done.
Lots of concerns there, Simon. If you're just joining us, by the way, 13 minutes past 8 on this special morning from the NHS in the south. Simon, your reaction to what you heard there?
I'm pleased to be able to actually try and address some of those issues, actually.
So let's do the mum at the end there, talking about young babies and so on.
Okay, well, I mean, I think the decision has been made recently that the Kingfisher unit in Dorchester will be remaining open, so I would hope that her concerns would be dealt with there. In terms of, I think, what's happening over here in the east of the county, I think the really important thing to stress about travel times is that what we're looking to do is actually improve the quality of care at the end of that journey. Now, we hear a lot about the golden hour, but actually the vast majority of admissions to hospital, emergency admissions, don't actually require the golden hour, so they're not time decisive. Myself as a GP, when I go and see people at home and I need to admit people to hospital, when I speak to the admitting team, what I get asked is, what sort of time frame would you like this person to be admitted to hospital in? And the vast majority of the time it's 4 hours. So it's not absolutely essential that they need to be in within that sort of hour time. Now, bearing that in mind, even if you do have a slightly longer journey, what we're looking to do is make that quality of care at the end better so that your outcomes are better. So in other words, you're more likely to survive, you're more likely to do better from whatever you need doing to you to make you better.
And are you the people who are saying to me, and we've had them on the air, saying, I hear that, but I'm still worried that in the old days A&E was in Poole and I live in that part of Dorset, and it's a long journey, particularly at busy times, from Poole to Bournemouth.
Yeah, and I think it's worth saying that actually at the moment, coming back to those time critical problems, for instance, I'll give you an example. If the main vessel in your abdomen, your aorta, ruptures, you need to have an operation very soon to repair that or you die. Vascular surgery isn't provided at Poole at the moment, so wherever you are, you either have to go to Bournemouth or to Dorchester.
So you're saying you'd still be transferred?
So, yeah, and heart attacks. So, again, heart attacks at the moment, if you call 999, an ambulance comes and they do an ECG, a heart tracing, and realise that you would actually benefit from having a stent put in your heart. Again, you don't go to Poole. Poole doesn't offer that service. So we already have the situation where people are actually travelling not necessarily to the closest hospital because the quality of care they get is better and the outcomes are better.